Public health officials across the country have been trying to build trust with black Americans, hoping to get as many possible vaccinated. But in Mississippi, black residents are still being vaccinated at far lower rates than white Americans. NBC News Now correspondent Priscilla Thompson joins us from Bolivar County in Mississippi. So, Priscilla, black residents in the state who qualify for the vaccine want it. What's going on here?
Well, Joe, good morning. You know, when we first began reporting on these disparities that we're seeing across the country, research suggested that the two driving factors were vaccine hesitancy and also a lack of access. And what doctors and community leaders are saying here in the Mississippi Delta is that those barriers to access are actually driving the disparities that we're seeing in this state. And I want to talk through what some of those barriers are. So one, of course, is just access to reliable internet. And this is something that when lawmakers come and campaign in these communities, they talk about the importance of rural broadband. And that's because not everyone has internet access here in places like the Mississippi Delta. The other big component here is transportation. Public transportation is not very robust in these communities. And we actually looked at the data on how many households own cars or have access to a vehicle. And what we found is that in the 10 counties where folks are least likely to have access to a vehicle, only 4 of those counties have vaccine sites, which means the majority of them don't have vaccine sites and don't have access to a vehicle to travel outside of the county necessarily to try to get that vaccine. And I should point out that all of those counties are majority African American. So part of that disparity that we're seeing there. And this is something that I spoke with Representative BENNIE Thompson about, who represents a large subset of the Mississippi Delta. And he said that that is simply unacceptable. Take a listen.
We now have, because it's a national pandemic, FEMA will pay 100% of the cost of whatever is required to immunize communities, everything. So there's no excuse for not having vaccine sites in every county.
And state officials here, for their part, the state health officials have acknowledged that barriers to access do seem to be becoming the bigger problem. They have promised they are making aggressive efforts to address that and shore up this disparity. But it really remains to be seen what exactly is going to happen and the impact that that will have. Joe?
Priscilla, how about doctors? What are they saying about solutions to the problem?
Yeah, well, one of the things that we're hearing from doctors here, much like across the country, is that they need more vaccine allotment, and they'd like to know how much they're getting on a consistent basis. But why that is important here is because clinics like the one behind me, this is one of only 2 clinics in this county that are able to vaccinate. They would like to set up mobile sites and go out to these communities, but they can't do that without a robust vaccine allotment to know that when they go out, it's going to have an impact. And I spoke with another physician here just up the road who is in the process of getting approval to hopefully begin vaccinations. And he echoed that sentiment of the importance of being able to set up these mobile sites. Take a listen to what he had to say.
Bring the vaccine to the people. If we have a large community, which we do in several areas in the Delta, being able to have a mobile site set up where you can get a large number of individuals vaccinated at one time, that would probably be a great solution to this problem.
And of course, the Biden administration has announced that they are going to be sending the states more vaccines this week. We'll see what impact that will trickle down and what trickle down effect that will have here in the Delta. But the other thing the Biden administration is doing this week is rolling out that partnership with retail pharmacies. So CVS, Walgreens, Walmart. But again, what community leaders here are saying is that in many of these rural communities, there isn't necessarily a CVS or a Walgreens or a Walmart. And so it's really important to be partnering with community clinics like this one. And also, lawmakers have suggested using schools or churches, places that every community has. Joe?
All right. Priscilla Thompson reporting from the Mississippi Delta. Thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.